So the one person I'm going to introduce is Kira Bradley, who has already been on today. And then we've got a special guest who's attending. She's a member of staff within the trust, who has unfortunately suffered from the consequences of developing pressure sores within this organisation. So if I could hand over to Kira and our special guest.
Hello. So yeah, like Stuart said, I'm going to be talking to Rebecca, who is a clinical support worker that works within our trust. And Rebecca developed pressure ulcer when she was a patient within this trust. So Rebecca and I are just going to have a chat now. We've got some questions that we are going to ask Rebecca, and then obviously if you've got any at the end, I'm sure she'll be happy to answer. So is Rebecca on?
I'm here. I don't know if you can hear me.
I can hear you. Hiya. So can we just start off, Rebecca, if you just please tell us a little bit about yourself?
Yeah, my name's Rebecca. Nice to meet you all. I work over at the Leeds General Infirmary at the moment on the neurology ward, L17. I'm a mum of 3 children, which is where I developed my pressure sore, giving birth to one of my boys. I've worked in the trust about 5 years now, but long history of caring in the community, in a dementia residential setting, and like I say now, within the trust, and wouldn't change it for the world. Absolutely love my job.
Fabulous, thank you. So can you just tell us a little bit more about how and when you developed your pressure ulcer?
Yeah, so I was having a difficult birth, like I say, with my eldest son 11 years ago now, back in 2009. Things didn't go as planned, and unfortunately my son's heartbeat started to drop and it was starting to struggle, so I was advised to have the epidural. I was young, didn't really know much about things back then. Took on the advice of the medics. I had an epidural, which obviously led me to being completely numb, no feeling from my waist down. This is where things started to develop. I was on incontinence sheets. I was moved up the bed with bed sheets. I wasn't rolled, I wasn't turned. I was just pretty much left, although medically observed from an OBS point of view. I was young. I don't think it was predicted at all, but just sort of left in one position, really, just moved up the bed on bed sheets when required.
How old were you, Rebecca, when you developed your pressure ulcer?
I was 17.
17, okay. And so do you have any ideas, obviously probably know what you know now about pressure ulcers, and you've had the pressure ulcer training within our trust, but why do you think the pressure ulcer happened?
I think it was a very prolonged period of time. I think I was in one position for approximately 12 hours, no rolling, like I said previously, literally just moved up the bed on bed sheets. Again, no feeling, so I wasn't aware that it was happening. And obviously as well, you know, my son was in a poorly way at that time. He was a priority. Yeah. Other things that a takeover, which I appreciate. But I think it was just the prolonged period of time of me not moving and the incontinence sheets scrunched up beneath me.
Is that just the flat Inco sheets?
Yeah, just the disposable ones. Yeah.
Did anybody, when you were in labour or when you first came into hospital, did anybody talk to you about pressure ulcer risk or what they would do to try and minimise your risk whilst you were in labour?
No, I wasn't. Nothing was mentioned about the risk of pressure. Again, I was only young. I had age on my side. I was a very active, healthy young lady. But no, nothing was mentioned about pressure to me.
Okay. How did you find out that you had a pressure ulcer?
So shortly after giving birth to my son, I was unable to get a bath and things due to still being numb. My mum offered to give me a freshen up and a wash, and as she was rolling me onto one side to change the sheets beneath me, she noticed what was purple unblanching areas. I had quite a few bruised look areas, one of them quite distinctive and very raw looking. And that's when my mum asked the nurse to come and have a look.
And did the midwife or the nurse come and have a look?
The midwife, yeah, she did come and have a look.
And what did they say to you about it?
They didn't say really much. I think obviously very, very shocked. I'm not sure if they realised it was a pressure ulcer at the time. but nothing really much was said. There was no follow-up to it after when I went to the ward or anything. It was just sort of left there and then, really.
Okay. Did you receive an apology from any of the staff?
I did.
You did?
Not at the time when I was an inpatient in the hospital. Going forward, once it developed and it was an open wound and they realised what had actually happened and it was a pressure ulcer, I did receive a written apology.
Okay.
And I think the team that was involved in the care at the time was obviously very upset about what had happened, and there was felt guilt, which is understandable. But yeah, I did get an apology.
Good. Do you know if it was formally investigated by the trust?
It was, yeah. It
Okay.
was, yeah.
Do you still have problems with the Pressure Ulcer site now?
Massively, yeah. From things being pain, uncomfortableness, I get quite a lot of shooting pains if I'm sat in an area for too long. I find myself sitting to one side. It's a very, very sensitive area.
Yeah.
But in other aspects of, going shopping for underwear, I'm very, very cautious. Is it going to be uncomfortable? Is it going to irritate? I have got a scar there. And for the self-conscious side of things, yeah.
So you've obviously gone on to have 2 more children after having your son. When you come in on subsequent admissions to have your children, has it been any different those times when you came in? Did anybody talk to you more about pressure ulcer risk? Did anybody acknowledge that you were increased risk because you had scarring, you'd had a previous pressure ulcer?
Yes, on both occasions. I mean, and I came in to the LGI on one occasion and to St James on the other, and both times they acknowledged the fact that they'd noticed on my record I'd had a pressure ulcer. They spoke to me about how my care wanted to be, how I wanted my care to be led, if there was anything they could do to help me prevent any more damage. So they was very much aware of that, and it set my mind at rest, knowing they was aware, and that the risk was reduced massively.
So you've noticed a big difference between the first time and then the next 2 times?
Oh, definitely, yeah, massively.
Let's just get back slightly. So when you developed your pressure ulcer, obviously it was quite a nasty pressure ulcer. How did it affect you? What impact did it have on you when obviously you had a newborn baby to look after?
The main barrier from the pressure ulcer for me was it prevented me breastfeeding my child. I wasn't able to sit down. I had to, sit on my hip, so to speak.
Yeah.
Couldn't get comfortable. A hell of a lot of pain, discomfort. Daily routine was up in the air due to the visits to the GP and other medical staff. But the main thing for me was the fact that I couldn't breastfeed my son because of the pressure ulcer. The first couple of days I was okay when it was a closed wound, but then it started to open, and I just couldn't go on from there. So that was the main thing for me.
Yeah. And what effect has it had on your longer term?
I think it's more self-image for me. I'm very, very cautious. I mean, luckily I'm in a long-term relationship, but still it's there. It's a scar. It's in a personal area. Even like I said, going back from when I said choosing underwear and things, it's always on my mind, and it's the first thought that comes to my mind.
Yeah.
So it's always there. It never leaves my mind, and I hate the fact that the scar's there. I hate it.
Are you very self-conscious about it?
I am, yeah, very self-conscious,
yeah. When you first had the pressure ulcer, obviously as it started to break down, which a lot of pressure ulcers do as they debride, who did your dressings and who provided your aftercare? What aftercare did you have?
In terms of being at home, my partner helped me with a lot of things post-birth, and because of the pressure sore, I had daily visits to the GP for the practice nurse to change my dressings. There was a period where I had to have it packed. I think I did daily visits for about 6 weeks. It wasn't possible in the area I lived for having anybody come to me. So it was a massive uproar when becoming a new mum, trying to get into a new routine of having a new baby. I was also young. I didn't drive at the time. So going to the GP was an absolute nightmare alongside being in the pain. It was a very, very difficult period and not not a short period. It didn't happen very, you know, fast. It took a long time to heal. And like I said, 12 to 18 months down the line, I was still going over to Wakefield to see specialists regarding the scar and things. So yeah, it was a long drawn out process.
Did you think when you first developed pressure ulcer it would take that long to heal, and that
Never.
you would have to have sort of a lot of interventions from healthcare professionals in that time?
Never, no. I thought, but I wasn't in healthcare from a professional point of view when it happened, so I didn't have the knowledge I have now, but didn't even realise really that it was going to open as a pressure sore. I just thought it was a bruise, you know, I wasn't knowledgeable at all about it. But yeah, I didn't think at all it was going to, and I never actually imagined I would have a scar for this long and for life, really. I thought it'd go away. Was
it quite a shock to you then when it started to break down and debride?
Yes. It broke my heart. I went into quite a downward spiral, actually, from a mental health point of view as well.
Yeah.
Because I just felt like I couldn't do anything, you know, I couldn't wear the clothes I wanted to wear, I couldn't be the mum I wanted to be, I was in pain all the time. So although it just some people think, you know, just a small pressure sore, it had a massive impact on me from a wider aspect.
What would you like to say to us as healthcare professionals about pressure ulcer prevention?
The small changes make massive differences, really. From personal experience, the extra 5 minutes to use a slide sheet, the incontinence pad doesn't need to be there. You know, it's a pain like no other. I wouldn't wish it on anybody, let alone somebody that's in hospital poorly anyway. I mean, you know, I was on the other spectrum. I was giving birth to my child, which I personally wasn't poorly, but to have a pressure sore as well as being poorly, I couldn't imagine it. You know, it's not just the wound that causes the problems. It's a long-lasting thing that has an impact on everything. So yeah, just the small changes make massive differences. Try not to skip corners. I know it's hard, but you know, check. Yeah. Move. That's all I can say. Really, it really is so important. It's such an uncomfortable experience for me, you know. And I was young, I was healthy, I was well nourished, I was active, I had age on my side. So for, you know, a little old man, 70-year-old, to develop one, I couldn't imagine it. It was very painful.
Yeah, I can imagine. And is there anything you could say or you would want to say to the staff who looked after you when you developed your pressure ulcer if they were here now?
I'd probably say accidents happen. I understand that now. You know, things do happen. We're only human. I just hope it's had a positive impact going forward. You know, I hope people learn from my experience. I wouldn't ever want it to happen to anybody else. And use it for educational purposes, really, you know, make changes. What can we do different? What can we do better? But I understand. I wouldn't ever hold a grudge against any staff member that, you know, was in my care. It's one of those things. I didn't at the time. There was absolutely fantastic with everything else. You know, my son's here to tell the tale, and that's all that matters. It's one of those things, but can be prevented.
Yeah, absolutely. Did you ever find out what category the pressure ulcer was? Did anybody ever tell you what category it was?
They never really said. I think it's between a 3 and a 4.
Okay.
It was very deep.
Yeah. Okay.
I think it was about 6 centimetres wide.
So yeah, it was across both buttocks?
It was, yeah, but I've just the scar on one buttock now, on my right buttock, yeah.
So you've sent the picture to us about your scar. Are you happy for us to show the people here the picture of the scar now?
Yeah.
Are we able to put that up, Stuart or Lisa? So this is the scarring that's left. And as you can see, it's quite a big scar.
Yeah.
And obviously now Rebecca has this scar. It has left her at increased risk of developing pressure damage over that area next time she comes into hospital, or if she's not very well at home. So it's something that even now, you're still a very young woman, it's something that you have to live with for the next sort of 50, 60, 70 years of your life. And your risk is always going to be a lot higher than somebody else of your age because of the pressure damage that you've had. Yeah,
and it's just not very nice to look at either. It's you know, for me, it is a very personal area. Yeah,
we really appreciate you talking to us and letting us show, you know, sort of people the pictures, because I think, like you say, we're aware probably of older patients being at risk of pressure damage, but actually any one of us comes into hospital, our risk automatically goes up.
Of course, yeah.
And there's lots of things, like you said, sort of like using the flat Inco sheets, you know, sort of having epidurals, and then you're not having any sensation. Obviously, when you're giving labour, there's a lot of moisture in the area, you know, so all of those factors have really increased your risk, and then obviously you've gone on to develop a really nasty pressure ulcer.
Yeah. No, I appreciate it. I appreciate being invited again. I just hope people learn from my experience, you know.
Thank you so much, Rebecca. Has anybody got any other questions?
So, Rebecca, thanks very much. It's Stuart here again. I just want to thank you really for being so honest and open, because I could hear in your voice it was quivering, and I could tell it still affects you quite deeply.
It does.
Yeah. So I know this has been difficult for you, but I can't tell you how important and how powerful your story has been, and how it can be more powerful moving forward for people. I was just wondering, has anyone on the call from the women's CSU, any midwives who might want to give a reflection? You don't have to if you don't want to. Okay, Lisa, I know you've come on screen. I don't know if there's anything you want to add. Lisa Grant.
Just absolutely so grateful to you, Rebecca, that honestly you've been inspirational, just, you know, being so honest and open with us, and I think this is when we hear the stories in this way, this will make the difference. We can talk about, you know, the tools, the techniques, what the evidence says, but when we hear from someone who's suffered and continues, you know, to suffer, we will learn from you. So thank you so very much for just taking the time to share. It's been brilliant. You're really, really good. Thank you.